So the purpose of Socially Connecting Shaftesbury was first of all to provide a hub for all things mental health and well-being, and different organisations to come under the same, in the same hub, and to provide something in the town hall, because it's a central location. People can get to, there's the bus stops outside, it's visible. But is to get the evidence together that something is needed in rural areas.
So you think there's not enough support in rural communities?
Especially around here.
Okay. Do you
Seems
think...
to be a big set to get all the support. Places like this get that.
The feedback that we've had from the organisations that have come today has been really positive. They said they've had some really good conversations, one-on-one conversations that they wouldn't have had. Just wouldn't have had, because people don't have the time when they phone the service to have that time with people. If people don't see a service, they believe it doesn't exist. Therefore, that adds to the stigma, because people will think, well, if other people felt the way I feel with my mental health, then there would be a service. So I must be the only one, when actually they're not. And if we were to make something visually available in rural areas, then that would be, the knock-on effect would be then that it would lower the stigma, it would raise awareness, and people would know where to go much earlier on.
How do you feel about the event that's happening today?
I think it's great that we have things like that in the town, and anything that makes people more aware of health and well-being is a good thing.
And the thing is, when we did the pilot last year, we found the responses from people from all age groups, from 18 plus to 90 odd, which was the joy of this event. It's accessible and all ages. We did a survey that was run by Health Watch Dorset, and over 75% of people that responded to the survey either agreed or strongly agreed that there was an inequality. They felt there was an inequality in rural versus urban mental health and well-being. So that's quite overwhelming, actually. And we've had the feedback saying that, you know, what you're doing here is just so important, because we estimated we helped over 100 people get support that they needed. If we hadn't have been here, what would they have done?
I had a rather unpleasant time, unfortunately, when we had the lockdown with my NHS GP, because they wouldn't see me when I was really very ill.
And we had somebody come today, walked through the door and said, "Oh, mental health, that's not for me," okay, which just proves the point about the stigma. So they were waiting for a bus. So I said, "Why don't you come in and have a cup of tea?" And by the time they left, they'd taken leaflets with them for different organisations, yeah? So actually stood up and said, "Do you know what? It is for me. It starts with a cup of tea and a conversation." And that's really it.